us every day. But what does it mean for a child to be hearing impaired? What is their world like? And how can we as healthcare professionals communicate with them effectively?
Deafness affects one's ability to communicate. In comparison to a well-hearing person, hearing impairment impedes the interaction with others and causes more difficulties and dysfunction to this group of people. Challenged by their disability, they are more at risk of social and physical isolation. According to Australia Hearing, 1 in 6 Australians suffers from hearing loss, and over 16,000 children under the age of 21 years old are deaf or hearing impaired, with 1 to 3 infants suffering from permanent hearing loss amongst 1,000 baby population. Hearing impairment has become the most congenital disability. Therefore, as statistics revealed, it is not a rare scenario for paramedics to attend to a child who is hearing impaired. Before we go any further, let's discuss some causes of hearing loss in children. Hearing loss can be congenital or acquired. The causes of congenital hearing impairment are due to genetics, such as mutation of genes, environment, such as prematurity, hypoxia, and infections. Hearing impairment can also be caused by unexplained idiopathic factors. On the other hand, excessive noise exposure, illness, exposure to certain drugs and chemicals are factors of acquired hearing loss.
Now that we've learned about the causes of children suffering from hearing impairment, let's explore of what options do we as paramedics have to enhance communication with them.
Here are some tips that you can use as a paramedic when communicating with patients or children with hearing impairment. Firstly, face the patient. Ensure that when communicating with the patient, you are not covering your mouth. Speak clearly and a little slower than normal. It helps the child who is learning or know how to lip read and makes it easier for them. Use signposting. Tell the patient what you're going to do first and then what will continue to happen next. It keeps the patient in the loop and reduces anxiety to both patient and parent. Take note of the sound, gesture, facial expressions, and any signal that they make. Seek clarification about the way the baby or the child react from the parent or guardian. Facial expression give good cues of how the child is feeling. For example, if the child is smiling, it could mean that they are happy and content. If the baby is crying, it could mean that he is sad, stressed, in pain, or in need of help. If the child is reaching and pointing, he may be wanting or needing something, such as an object or a toy. If the patient is in a cringing or guarding position, it could mean that the patient is in pain. But always confirm with the parents to be sure of the expression received. The parents do understand the child better in the ways that the child communicates. Do not underestimate the power of touch. Hold their hands, cuddle them if need to. It provides reassurance to the younger patient and helps in calming them down. Use eye contacts. If sign language is used, ensure that the child looks at you. It is important to get the child's attention before you talk. Also, if possible, stand or sit at the same level as the patient. Toys are usually used to attract a child's attention, to focus on the clinician, or to distract him from the pain and presenting problem. Use communication tools such as pen and paper or communication board. Try not to crowd over the child. Create open space. Imagine how intimidating it can be to have more than 3 adults speaking over you all the time. Apart from all those mentioned, be patient. Understand that it could be an extremely frightening experience for the child to see unfamiliar faces who wants to carry out all sorts of various medical procedures on them. Needles and blood are still scary to a child. Now, if you like, you can pause the video and try to remember the 4 skills that we have discussed just then that would be handy when communicating with a child who is deaf. Environment plays a vital role when it comes to communicating with a patient who has special needs. Being in a pre-hospital setting may be an advantage to the paramedic, as the patient could be in his or her home and is comfortable with the surrounding. On the other hand, if the child is not in his comfort zone, it could be a disadvantage in the sense that it makes it hard to connect with the child, as the child may already be in too much fear and discomfort. Therefore, as paramedics, you are to create an optimal environment in the pre-hospital settings to maximize the communication outcome. Changing the environment makes significant differences to a child. For example, provide comfort. Think cushions, toys, and pillows. This helps the child to settle in. Orientate the patient to the settings either through the presence of a family member or having familiar object near the patient. Move away or reduce background noise so that the child who is able to hear can focus better. Shutting doors or windows and asking parents to keep the noise level down may help. Ensure the lighting in the room is good for the child. Avoid standing in the light source and ensure that the patient can see clearly what you're saying through words or sign language. Having the ability to communicate with a child who is deaf is definitely an advantage. For the next segment of this video, we are going to be practicing Auslan. Auslan stands for Australian Sign Language. It is one of the tools that are used vastly for people to communicate with people who are deaf. The first few are to introduce yourself and to build a good rapport with the patient.
How are you? How are you? I'm a paramedic.
Next, we will learn how to sign to a child to ask questions regarding their presenting problem and management.
Do you have pain?
Ambulance. Ambulance.
Hospital. Hospital.
I hope that you have benefited from this video. The take-home message is that despite the disability that the child you attend to may face, as healthcare professional, it is your duty to provide holistic care. The patient, apart from being hearing impaired, is not much different from any other child. They still have their fears, still long to be reassured, may not like their veggies, and still like to run around and have fun. It is crucial for paramedics and other healthcare workers to understand that the key to delivering patient-centered care is